You can liken congestive heart failure like a traffic jam, hence the picture here. Picture that the heart that is now very tired and is unable to keep up with the needs of the body, it's like a lane closure. Maybe there's an accident, maybe there's a stall on the side of the road right in the heart, and now the heart's ability to pump that blood quickly and keep up with the needs of the body is now reduced. So now, if blood is not able to move through that traffic like it can, then blood starts backing up everywhere that traffic is entering that. So on ramps, off ramps, trying to lead up to this one area, the heart, blood is now backing up in the body, and that's the congestion. That's this congestive part of heart failure. And left-sided congestion looks a little bit different than right-sided congestion. A lot of congestive heart failure, both may be diagnosed at the same time, but not always. Oftentimes, some of the symptomology may speak only to right-sided or only to left-sided, so let's visit those. We're going to start with the right side. So if our heart is right around here and the right side of our heart is what pumps the oxygen in the blood, we'll draw in blue. If there is a stall somewhere on the right side of our heart, meaning that the right side of our heart is just not able to keep up with that amount of blood, all the blood that's entering is trying to get into the right atria, but the right atrium, but the right atrium, maybe it's backing up, right? So now traffic is backing up from the superior vena cava and the inferior vena cava and everywhere else that it relies to. So blood that's entering, trying to enter here is backing up. It backs up on the lower extremities. You can see edema and swelling in the lower extremities. If it backs up in the abdomen, you can see a condition called ascites, which is an increased amount of abdominal fluid in the abdomen. The reason for this is because veins leading up to the heart are so under such pressure that it creates what's called pulmonary hypertension. And this creates very small openings in some of the smallest venules and capillaries where that fluid is able to leak into the tissues and not make its way back up. JVD stands for jugular vein distension. Blood that is returning from the brain and the head and trying to get back into the superior vena cava. It backs up here. You can see enlarged veins in the neck here as well. Hepatomegaly. Most of the blood that comes from all of our body that goes towards the heart has to pass through the liver. The liver will actually take in a lot of this extra blood and become enlarged, and you actually see an enlarged liver, and you can actually start palpating it and feel it under the rib cage on the right side of the abdomen. Splenomegaly, same thing on the left-hand side. The spleen is about the size of a fist just underneath the left side of your rib cage. You shouldn't be able to palpate that, but you can with patients with right-sided congestive heart failure. And then this all makes patients feel very tired. This is one of the symptoms that most people with congestive heart failure feel, is that fatigue, that excessive weakness, tiredness. Left-sided heart failure looks a little bit different. As my red is running out here, just grab another one. So red's a little bit different, right? So blood that's going into the left atria, where is that coming from? It's coming directly from the lungs, right? So blood backs up in our lungs in this one. So as blood starts backing up and congesting into the lungs, we start feeling shortness of breath, fatigue, because we're tired, not getting enough oxygen. Patients will start coughing because they can't get enough air. Hemoptysis is a coughing up of blood from the respiratory tract. So if enough blood backs up in the lungs, they may actually cough it out. Cyanosis, if we're not getting enough oxygen, our tissues can turn blue. It might have a bluish tinge to our skin. If we're not getting enough oxygen, our heart gets the message to beat faster because it needs more, so our heart rate increases, our breathing rate increases as such too. Because we're overworking our heart, the heart's left side, especially the left ventricle, which is the largest part of our heart, that left ventricle gets much, much larger. If we're going to visit some of this symptomology here, we have some pictures. Right side congestive heart failure. This is pitting edema. You can see the edema, the excessive fluid being retained here because it's not able to go through the heart as it needs to. Pushing down, you can actually see it takes a long time to bounce back. That is severe edema in this patient. This patient also has right-sided congestive heart failure. You can see the jugular vein distension in the neck. And then this is a site use. This is the excessive abdominal fluid retention in right-sided. Left-sided heart failure, this is a CT scan of a transverse patient. If you think about them laying down on the CT scan like this, their feet towards you, their head beside you, and they're in the supine position facing the ceiling. This is their liver on the right-hand side. This is their spleen, and the spleen should be significantly smaller, but you can see this is splenomegaly in a right-sided congestive heart failure patient. Left-sided congestive heart failure patient, we have a normal chest x-ray with a normal heart size. Over here we have a chest x-ray, but with a significantly increased heart size that you see in cardiomegaly, which is often seen in left-sided heart failure. So when patients are coming in and explaining some of these explaining some of these symptoms, or if they already have congestive heart failure on their diagnosis list, very important to check up on them and see how they're doing with each of these symptoms.